Welcome to The Explainer. Today we're diving into something that affects literally every single one of us and taking a totally objective, detailed look at the economic mechanics driving one of the most fiercely debated topics in the United States. We are talking about healthcare costs. We're going to look past all the political rhetoric, pop the hood on the actual gears of the system, and find out exactly where the money goes. Okay, let's dive right into this. Section 1, the medical sticker shock, unpacking the bill. Picture this. You go in for a totally routine medical procedure. We've all been there, right? Or at least we know someone who has. Maybe you go to the hospital for some preventative tests, a scheduled minor surgery, or even just a quick trip to the ER for a sprained ankle. The doctors are super attentive, the facility is spotless, you get stitched up or scanned, you head home and you recover. Everything goes exactly as planned, and honestly, you feel pretty great about the care you received. But then, the mail arrives. You rip open that envelope and boom, you're staring at thousands of dollars in charges. It's that visceral, undeniable sticker shock that just makes your stomach completely drop. You look at this single, heavily coded piece of paper and wonder, how in the world could 3 hours of care possibly equate to the price of a used car? You start doing the math in your head, trying to map those brief interactions you had with the nurses and doctors to this monumental final figure. So it begs the question, doesn't it? How exactly did healthcare become so incredibly expensive in the United States? Well, there isn't just one simple villain here. It's actually a fascinating, deeply intertwined web of economic factors, massive administrative layers, and competing incentives, all colliding to create that massive number at the bottom of your bill. To figure out why the numbers are so high, we have to track the dollars from the exact moment you walk through the hospital doors. Section 2, a complex web of participants, the healthcare ecosystem. Now, what's really interesting about this slide is that when you get care, you aren't just paying a doctor. You're activating a massive, multi-layered network. The revenue pie is remarkably fragmented. You've got patients, hospitals, insurance companies, pharma and device manufacturers, and government programs all occupying roughly equal 20% shares of the whole ecosystem. Every single slice plays a highly specific role in how care is delivered, and crucially, they each have their own massive operating costs that need to be fed. The hospital has to maintain its buildings, the insurance company has to process claims, and the device manufacturer has to fund R&D. So your bill is essentially feeding all of these competing sectors simultaneously. Section 3, insurance and administrative hurdles, the invisible costs. Let's think about how Americans actually get their coverage. It comes through a highly varied set of channels. Lots of folks receive insurance through employer-sponsored plans. Others navigate the open market for individual private plans. And millions rely on absolutely vital public programs like Medicare or Medicaid. Because everyone walks through the hospital doors with a totally different type of financial backing, the entire system has to adapt to constantly shifting rules, varying provider networks, and fundamentally different payout structures. It's a decentralized environment that inherently breeds friction. I mean, a hospital can't just have one billing process. They literally need a dozen different workflows just to accommodate the specific demands of every single insurer. And this brilliantly illustrates one of the absolute wildest parts of American healthcare economics, the massive gap between the charge-master rate and the negotiated rate. These are two completely different economic realities. For example, a hospital might list an initial charge of over $125,000 on a bill for a complex procedure, but your insurance company has a pre-negotiated private contract dictating they will only actually pay, let's say, $15,900 for that exact procedure. This two-tiered pricing system makes it nearly impossible for the average person to know what a service actually costs before they get it, because the initial charge is rarely the final negotiated reality. Now, navigating those different realities requires a tremendous amount of human capital. Behind every doctor is an invisible army handling specialized medical coding, highly complex billing, and endless claims processing, just to ensure compliance with strict regulatory requirements. To handle all those different insurance plans and negotiated rates we were just talking about, hospitals and insurers have to employ massive administrative staffs. So when you pay a medical bill, you aren't just paying for surgical tools and bandages. You are actively funding the massive administrative apparatus required to translate medical procedures into thousands of billing codes, audit the claims, appeal denials, and just generally keep the revenue cycle moving. Let's move to and see how this builds in Section 4, the true cost of care, the physical realities. Because, beyond all the paperwork, the actual physical delivery of modern medicine is incredibly resource-intensive. Methodically looking at this, advanced imaging machines and robotic surgery systems absolutely improve care and save lives, for sure, but they carry a huge premium to purchase and maintain. Add in the high cost of specialty prescription drugs, the overhead of administration we just covered, and a highly compensated labor force, and your baseline operating costs skyrocket. And we can't forget emergency readiness. Hospitals must be prepared to treat critically ill patients at any given second. That means million-dollar equipment and highly trained staff must be running 24 hours a day, 7 days a week, regardless of patient volume. That constant state of readiness is a massively demanding financial baseline. Zooming in on prescription drugs for a second, we often see a tale of two extremes. On one hand, many basic, generic medicines are actually highly affordable and accessible to the vast majority of the population. But on the other end of the spectrum are specialty drugs, incredibly complex therapeutics engineered for rare or severe conditions. The astronomical costs to research, develop, run clinical trials for, and manufacture these targeted treatments act as another undeniable driver of overall healthcare spending. Finally, we absolutely have to account for the human capital delivering the care: the doctors, nurses, pharmacists, and technicians. Safely treating the human body requires individuals who have undergone years, sometimes decades, of intensive specialized education. Because of this incredibly high barrier to entry, the staggering student debt often associated with that schooling, and the immense liability required to make life or death decisions every single day, their expertise commands a natural premium. This makes labor costs an entirely essential yet massive part of total healthcare spending. Section 5. Systems that shape healthcare, the global context. It's really important to impartially note here that different countries organize and finance healthcare in entirely different ways. The United States is unique in its structure. Every nation around the globe has its own distinct framework, and with that, their own unique trade-offs. Some systems excel at driving rapid technological innovation and offering immediate access to the absolute newest treatments, while others prioritize managing overall affordability, centralizing administration, and guaranteeing universal access to basic care. So the crucial point is this: when we return to our core question of why American healthcare costs so much, the answer is a combination of these major pillars. It is the compounded result of advanced medical technology, a highly trained and valuable labor force, a deeply fragmented insurance landscape, the heavy burden of administration, multi-tiered pricing, and the overarching structure of the system itself. Understanding how all these interconnected factors operate together explains exactly why healthcare in America carries such a remarkably high price tag. Which leaves us with a final thought to ponder. If your individual costs are inherently shaped by this vast, systemic structure, how might future changes to this complex web ultimately impact your next medical bill? It's a fascinating intersection of economics, system design, and personal finance. Keep this entire ecosystem in mind the next time you open an envelope from the hospital. Thanks so much for joining me for this explainer, and keep questioning the systems that shape our everyday lives.